Hi, Mr. Harding. My name's
Hi.
Dr. Thacker.
Hi, Doc.
Hi. Do you mind if I examine you? Would that be all right?
Yeah,
Lovely.
perfectly.
If I cause you any discomfort, please let me know.
Right.
I'm just going to stand at the edge of the bed to start with and have a look at you, and then I'll carry on.
Right.
Okay? Lovely. Look at your hands to start with, if that's all right. Excuse me. And this side. Great. Okay. Okay. Do you have any pain in your shoulders?
No.
Okay, I'm just going to raise your arm up.
Right.
That's fine. Rest it down. Okay. If you wouldn't mind just resting your neck back and just turn your head to the side. That's fine. Lovely, that's fine. Okay. You stick your tongue out for me? That's great. Thank you very much. Okay. If you wouldn't mind just resting your neck back and just turn your head to the side. That's fine. Lovely, that's fine. Okay. You stick your tongue out for me? That's great. Thank you very much. Okay. Okay. If you could just turn your body to the side a little bit, that's great. That's fine. And back. Okay. Would you mind sitting forward for me? Just going to listen to your lungs at the back.
Hang on.
Take some deep breath in and out for me. That's fine. Just lie back for me now. I'm just going to press on your legs. You could just rest it down actually if you'd like. You could just rest it down on the bed if you like.
Right.
Lovely, thank you. Great. Lovely. Thanks very much.
Thank you. Cheers, Doc.
As with any cardiac patient, it's important to do a general inspection, and that can be done from the end of the bed. And you can see this gentleman has a midline sternotomy scar and is not breathless at rest. It's then important to go through the full cardiac routine. It's important to keep in mind what sort of lesion this gentleman might have, and is there any evidence of cardiac failure, as well as any evidence of infective endocarditis. If someone's had an operation, you need to think about things that might come up in PACEs, such as congenital heart disease, any valve replacements, for example, or does he have ischemic heart disease. I examined Mr. Harding's cardiovascular system. He had evidence of an aortic valve replacement and also evidence of mitral regurgitation associated with atrial fibrillation. On general inspection, he had a midline sternotomy scar. There was no evidence of endocarditis in his fingernails, and his pulse was irregularly irregular at a rate of 95 per minute. I would then like to have gone on to examine his blood pressure. His JVP wasn't raised at 45 degrees, and his apex beat wasn't displaced on palpation of his precordium. I could hear the prosthetic sounds of a valve, and on auscultation of his precordium I could hear a metallic valve over the aortic area and a mitral regurgitation over the mitral area. He may well have had a history of rheumatic heart disease. When examining someone from a cardiovascular point of view, it's important to examine them at the end of the bed. We could see in this case, this gentleman had a midline sternotomy scar, and you could hear a prosthetic heart sound. When examining his hands, it's important to look for signs of endocarditis, and of course to examine the pulse. In the context of any cardiac patient, you need to time the pulse for 15 seconds and also examine for a collapsing pulse. When you do this, if you ask the patient if they've got any pain in their shoulder, it's considered respectful. After assessing the JVP for cardiac failure, if you look in the mouth for signs of central cyanosis, and then go on to assess the precordium, palpate for the apex beat, and then auscultate for cardiac sounds. In this case, this gentleman had an aortic valve replacement, which was mechanical. The examiners may ask you to comment on whether or not it was mechanical or a bio heart valve. In this case, this gentleman also had evidence of mitral regurgitation, and this was consistent with the finding of atrial fibrillation, which we found at the beginning of the examination. It's important to comment to the examiner if there's signs of heart failure, as well as signs of endocarditis, and any etiology you might think this gentleman might have for his disease.